If you're a man over 60 and you've stopped masturbating, or you're thinking about stopping, this video is for you. This is one of those subjects most men don't talk about, not with their friends, not with their wives, and often not even with their doctor. Yet, the truth is, how and if you masturbate after 60 is far more important than you might think. Today, I want to have a real conversation. No embarrassment, no shame, about what actually happens to your health if you give up masturbation completely in your golden years. And I'm going to tell you what your body is really trying to say. I'm Dr. Thomas Meyer, a urologist, and for over 30 years, I've been talking with men about the things nobody else wants to discuss. I've seen every situation, heard every story, and I know firsthand what's normal, what's healthy, and what's dangerous when it comes to aging, intimacy, and solo pleasure. I've had patients in their 50s, 60s, 70s, even in their 80s, ask me if it's normal to stop, or if they're doing something wrong by still wanting to enjoy their own body. Let's get this out of the way. Masturbation, at any age, is normal. There's nothing shameful about it. In fact, for most men, it's an important part of maintaining not just sexual health, but physical and emotional health as well. But just because it's normal doesn't mean everyone keeps doing it forever, and the reasons for stopping can be complicated. Loss of desire, physical changes, shame, guilt, religious beliefs, or simply that life gets in the way. Whatever your reason, it's your choice, but you should know exactly what that choice means for your health. Let's start with the most basic and most ignored part of the story, your prostate. The prostate gland sits just below your bladder. It's about the size of a walnut, but its job is huge. It makes most of the fluid in your semen. And here's the kicker. Your prostate doesn't care if you're 20 or 80. It keeps producing fluid, day in, day out, no matter how old you are, and whether or not you're sexually active. When you were younger and ejaculating regularly, that fluid had somewhere to go. Your body was flushing it out, keeping your prostate healthy and clear. But when you stop, when that release stops happening, either with a partner or solo, the fluid starts to build up. At first, you might not notice anything at all, but over weeks, months, and years, something changes inside that walnut-sized gland. The fluid can become thicker, almost jelly-like. The ducts inside the prostate can get blocked. Pressure builds. Some men develop a dull ache in their pelvis. Others feel pressure or heaviness just behind the testicles, and some find themselves getting up more at night to urinate, or struggling to empty the bladder all the way. I remember one of my patients, George, who was 73 when he came to see me. He'd always had a healthy sex life, but after his wife died, he said the urge to masturbate just vanished. Over time, he started noticing that urinating felt harder, and there was a nagging discomfort that wouldn't go away. He thought it was just old age or maybe his prostate getting bigger. But when we did an ultrasound, what we found was classic. His prostate was swollen, a little inflamed, and congested. It wasn't cancer, it wasn't an infection, it was years of fluid just building up with nowhere to go. What can happen when this goes unchecked? For some men, nothing at all. They never notice and go on just fine. But for others, the risk rises for prostate stones, which can be painful. Chronic prostatitis, inflammation that causes pain and urinary issues, and sometimes even infections, because stagnant fluid is the perfect place for bacteria to grow. I've seen men who go years without release, and suddenly they're in my office with pain, burning, fever, or blood in their urine. It doesn't have to get to that point. Does this mean you must masturbate if you're over 60? No. But if you still feel the urge, even once every couple of weeks, it's actually healthy for your prostate to follow that urge. Think of it like flushing your engine. It keeps things running smooth. But the story doesn't end with your prostate. There's another, often invisible consequence of quitting masturbation that most men, and frankly, most doctors, never talk about. The effect on your hormones, especially testosterone, and your overall sense of well-being. See, every time you become aroused, touch yourself, or reach climax, your body goes through a complex but very natural cycle. Your brain releases a surge of chemicals, dopamine for pleasure, oxytocin for connection, and yes, even a spike of testosterone. You probably remember when you were younger that after a good solo session, you felt calmer, lighter, sometimes sleepy, but often just a little more at ease in your own skin. That's not an accident. That's your body's chemistry working as intended. When you go weeks or months or even years without any kind of sexual release, something subtle starts to shift. Your brain gets fewer of those pleasure signals. Over time, your baseline mood can dip. For some men, this looks like a slow, creeping sadness. For others, it's more about irritability, poor sleep, or feeling disconnected from their own body. Some guys even notice they're less motivated to exercise, see friends, or engage in their favorite hobbies. Let me give you an example. There's a patient of mine named Bill who came to me complaining about being in a funk for months. He wasn't depressed exactly. He just felt flat. When I asked about his sex life, he laughed and said, "That ship sailed a long time ago, Doc." But as we talked, he admitted that he sometimes missed that sense of release, and that he'd never considered it might matter at his age. I encouraged him, just once a week if he felt the urge, to allow himself a moment of pleasure, no guilt, no shame. A few months later, he came back smiling. "I don't know if it's all in my head, but I feel more like myself," he told me. "My sleep's better. My mood's better. I'm even getting outside and walking more." That's not a fluke. For many men, regular release helps maintain a healthy testosterone rhythm, which translates to more energy, a steadier mood, and yes, even better sleep and immune health. Now, I want to be clear. You don't have to force it. If you genuinely have no desire, that's normal too. Some men's drive fades naturally with age, and they're perfectly happy without it. But if you still have the urge, even a little, listening to your body is not just okay, it's good medicine. But what about the men who quit because of pain, discomfort, or embarrassment? This is where things can get tricky. Sometimes the physical act is less comfortable than it used to be. Skin thins with age. Blood flow isn't what it once was. Erections can be softer or take longer to achieve. Some men experience soreness, and others simply get frustrated when things don't work like they did at 25. This is where being gentle, patient, and kind with yourself makes all the difference. There's no shame in using lubricant. Actually, it's recommended for almost every man over 60. Take your time. Explore what feels good, even if it's different from your younger days. If you experience persistent pain, swelling, or notice blood in your semen or urine, don't ignore it. Make an appointment. Sometimes it's something simple, and sometimes it's a sign of a medical issue that needs attention. If you find yourself quitting because of embarrassment or old beliefs, maybe you were taught that masturbation was shameful or for young men only, I'm here to tell you, as a medical professional and as someone who's heard every story there is, those old rules do not apply. Your health, happiness, and comfort are not something to be ashamed of at any age. And for the men who stop because of medication or chronic illness, maybe you're on heart pills, or you have diabetes or nerve problems that make pleasure difficult, please know you're not alone. There are many ways to adapt. Sometimes adjusting medications or adding physical therapy can help. Sometimes just changing the routine, different times of day, different methods, can make all the difference. But let's not forget another important factor: relationships. Many men in their 60s and 70s are in long-term marriages or partnerships, and the dynamic of solo pleasure can change. Some partners may feel threatened or worry that masturbation means there's a problem in the relationship. In reality, it's a natural way to maintain sexual health, and it often helps couples maintain intimacy by reducing pressure or performance anxiety. If you have a partner, talk openly. Explain that your solo habits aren't about dissatisfaction. They're about keeping your body and mind healthy. For some couples, shared intimacy is possible. For others, private moments are just as healthy. What matters is understanding and communication, not secrecy or guilt. Now, you may be asking, is there a risk if I stop completely, even if I feel fine? For some men, the answer is no. They never notice a problem. For others, problems show up slowly: prostate congestion, urinary issues, low mood, or sleep changes. It's a roll of the dice, and genetics, general health, and lifestyle all play a role. But the research is clear. Men who maintain some pattern of sexual release, even infrequent, tend to report better quality of life, steadier hormones, and fewer prostate problems overall. Let's recap this section with the honest truth. Masturbation is not just about pleasure. It's about health, hormone balance, and emotional well-being. Stopping suddenly can lead to prostate congestion, mood shifts, and sometimes physical discomfort. The solution is not to force yourself, but to listen to your body and never let shame be the reason you stop. If you have problems, don't suffer in silence. Your doctor has heard it all, and there are solutions. So what should your routine look like if you want to protect your prostate, balance your hormones, and keep your confidence as you age? Let's get practical. If you still have desire, any desire, even once a week or every other week, allow yourself to enjoy solo pleasure, just as you would have at any point in your life. There's no schedule, no quota. Listen to your body. If you find you feel better after, notice if your mood, sleep, or even your energy improves in the days that follow. Be gentle. As you get older, your skin and tissues are more delicate. Always use a lubricant. Water-based is safest, but any that feels good and doesn't irritate is fine. Take your time. There's no rush. What matters is comfort and pleasure, not performance. If sensation is less than before, that's normal. Focus on the feelings you do have, not what's changed. If you have trouble getting or keeping an erection, don't feel discouraged. Sexual response after 60 is different for everyone. Some men find that it takes longer, some need more stimulation, and some may not get fully hard, and that's okay. You're not less of a man because your body has changed. The important part is connection to yourself, and if you have a partner, to each other. Some men are afraid that masturbation will worsen their prostate or use up their testosterone. The evidence shows the opposite. Regular ejaculation is associated with lower rates of prostate congestion and sometimes lower rates of prostate cancer. Testosterone levels may dip briefly after climax, but regular sexual activity actually helps maintain the healthy hormone rhythm your body needs for mood, muscle, and metabolism. But maybe you're in the other camp. You've lost all desire, or you have a chronic health condition that's changed your body's response. Maybe medication, surgery, or illness has made solo pleasure impossible or simply not interesting anymore. If that's you, don't worry. You're not doomed. There are still habits that can help keep your prostate and hormones healthy. First, stay physically active. Even simple walking or stretching increases blood flow to your pelvis, which helps your prostate and bladder work better. Second, stay hydrated. Dehydration concentrates your urine, which can irritate your bladder and prostate, making urinary symptoms worse. Third, eat a diet rich in healthy fats, leafy greens, tomatoes, berries, nuts, and seeds. These foods have all been linked to better prostate health and hormone balance. One trick I recommend to many older men is pelvic floor exercises, sometimes called Kegels. These are simple muscle clenches, like stopping a stream of urine mid-flow, then relaxing. Try to do a set of 10 squeezes, holding each for 3 to 5 seconds, 2 or 3 times a day. This keeps your pelvic muscles strong, supports better urination, and may even boost sexual function if and when you're interested. Now, it's important to know the red flags. If you notice pain during or after masturbation, new or worsening pelvic discomfort, blood in your urine or semen, fever, chills, or burning when you pee, those are signs you need to see a doctor. Sometimes these are just infections or minor inflammations, but sometimes they're early signs of something more serious. Don't tough it out. The sooner you get help, the easier the fix. Let's talk about the emotional side. I've had patients feel guilty about solo pleasure or feel less than because their desire has faded. Let me be clear. You are not broken. Desire fluctuates with age, health, stress, grief, and life changes. Sometimes a dip in interest is a sign of depression or low testosterone or a new health condition. Sometimes it's just a season of life. The solution is never shame. If you're worried, talk to your doctor. They can check your hormones, medications, and overall health to help you find answers. If you have a partner, don't be afraid to talk honestly. Sometimes, as one partner's interest changes, misunderstandings or even hurt feelings can arise. Intimacy in your 60s, 70s, and beyond looks different for everyone. Sometimes it means less sex, sometimes more touch, sometimes just being close in other ways. What matters is respect and communication, not comparison to the past, but enjoyment of the present. You might wonder about frequency. How often should I masturbate after 60? There's no single answer. For some, it's a few times a week. For others, once a month is plenty. Some men go without for months or years and feel fine. The key is, if you have the urge, don't suppress it for reasons of guilt or outdated advice. If you don't have the urge, focus on overall health and connection in other ways. I want to share another story from a patient named Michael, age 76. He'd stopped masturbating after a bout of illness and never really got back into the habit. Over time, he noticed new pelvic discomfort and more nighttime trips to the bathroom. He was embarrassed to talk about it, but when I explained the link to prostate congestion, he was relieved to know there was a simple fix. Just once a week, he began to allow himself a private moment, and within a few months, his symptoms improved. It's not magic. It's biology. Now let's touch on those who are truly unable or uninterested, perhaps due to surgery, medication, or other reasons. For these men, regular prostate checks become even more important. An annual visit to your doctor with an exam and possibly a PSA blood test can catch early problems and give you peace of mind. Don't skip these appointments. To sum up, here's what I want every man over 60 to remember. Masturbation is a normal, healthy habit at any age. If you still desire it, it's not just okay, it's good for your body and mind. Regular release helps prevent prostate congestion, inflammation, and for some, even infection. Solo pleasure supports hormone balance, mood, sleep, and overall confidence. If you lose interest, don't feel guilty, but stay active, eat well, and talk to your doctor about changes in mood or health. Always use lubricant, go gently, and never ignore pain, swelling, or blood. These are signs to seek help. If you have a partner, keep communication open. Intimacy can take many forms, and every couple is different. Get annual prostate checkups, especially if you're not sexually active or have other health conditions. If you take one thing from this video, let it be this. Your health after 60 is about more than just surviving. It's about enjoying life, feeling confident, and staying connected to yourself and those you love. Shame and silence have no place here. If this message resonated with you, please subscribe to Better After 60. Drop a comment below, share your experience, ask your questions, or suggest the next topic you want covered. This channel is here to help you live better, not just older. Remember, I'm Dr. Thomas Meyer. You deserve answers, you deserve support, and you deserve to feel like yourself. Body, mind, and spirit, no matter your age. Thank you for listening, and I'll see you in the next video.